Good morning, everyone. Myself, Dr. Pankaj, and welcome you all in Pedia Academy by Dr. Pankaj. Today we are discussing, continuing this amazing series of NEET SS Pediatric previous year topics. So today we will discuss the important topic that is Wilson disease. So this will be very useful and very important topic as in theory as well as in clinical practice. So without further delay, let's start. Wilson disease is hepatocellular degeneration. It is also called as hepatocellular degeneration. So this is important thing. This signifies pathological significance of this disease as this is called as lenticular degeneration. So Wilson disease is autosomal recessive. Again, it is important. Leads to copper buildup in liver, brain, and other organs. Basically, what you have to say, in Wilson disease, copper excess is there. There is mechanism behind it. We will discuss it later. But in gross sense, copper get accumulated in different organs, and that leads to Wilson disease. Okay, symptom like liver disease, neurological issues, psychiatric changes, and KF rings in cornea. So we will discuss these symptoms later on in detail, but mainly it involves liver, CNS, and eyes symptom. It can be fatal if untreated, and early diagnosis is crucial for treatment, genetic counseling, and screening of relatives. So, what is pathogenesis behind Wilson disease, behind copper accumulation? So, the gene is very important, ATP7B on chromosome 13. Remember, it is ATP7B gene, it is not ATP7A. So, one gene is also there, ATP7A. This is seen in Menkes disease. Menkes disease. So this is differentiating point from Menkes disease. So what is the function of ATP7B gene? What it does, basically it does in liver, it transport copper in hepatocyte and excrete it into bile. There it incorporate with ceruloplasmin. Basically, it is associated with copper transport. It excrete copper in bile, and these bile incorporate in ceruloplasmin. What happens when mutation in this ATP7B gene occur? There is decreased excretion of copper from liver. So if there is decreased excretion of copper from liver, then it will get accumulated in liver, brain, and kidneys, and brain also. So various toxic effects may be seen. So this is pathophysiology behind it. It is basically copper excretion problem due to ATP7B gene mutation on chromosome number 13. Okay, so when disease get onset, it onset as early as 3 years up to 80 years, milder mutation. So it has wider spectrum. Basically, it can occur in any age spectrum bearing the infancy. So, what are the clinical manifestations? We will discuss them in detail. So, first, the foremost, the liver disease, because copper it is accumulated in liver. So, in liver, again, we'll draw a diagram, rough diagram of liver. So, when copper get accumulated, it will get hepatomegaly. That is obvious. Chronic hepatitis, acute liver failure because copper is accumulated. Delayed puberty, amenorrhea, and coagulation defect because of liver is epicenter of synthesis of many steroid hormones and coagulation factors. So these get affected, and female are more likely to present with acute liver failure. This is the important point. Females are more likely to present with acute liver failure. Then again, the copper will accumulated in CNS. In CNS, the typical symptoms like intention tremors, dysarthria, dystonia, and Parkinsonism. And behavioral changes will be seen, psychosis, school performance decline. So this is important, and sometime it is presenting features like baby or children is not doing well in school. So yeah, maybe presenting symptom. Okay, in eyes, just see this is Kaiser Fisher ring that is popularly known as KF ring. So, what you have to know about KF ring? So, what is this KF ring? KF ring actually this is deposition of copper in descent membrane. So as you can see here, this is deposition of copper in basement membrane. We have to see it against slit lamp examination. We will discuss this later also. Again, we are discussing like psychiatric symptoms. So, Wilson disease can present as psychiatric symptom. The patient goes to OPD of psychiatry and later it turned out to be Wilson disease. So, this is very important consideration and differential point in Wilson disease like depression, personality changes, anxiety and OCD disorders might be there. Again, the very important thing, the hemolytic anemia, cum negative hemolytic anemia may be the first sign. A hematologist or pediatrician is evaluating the patient with anemia with no other features, and he or she found hemolytic anemia like LDH increase and other parameters of hemolytic anemia with cum test is negative. So this cum negative hemolytic anemia may be the first manifestation of Wilson disease. This line is very important. Other renal symptom, because copper can get accumulated anywhere. So in renal issues, the Fanconi syndrome, renal failure, altered amino acid, glucose and uric acid transport can be there. So what are the other manifestations? They are sometimes asked like arthritis, pancreatitis, nephrolithiasis, infertility, cardiomyopathy, and hypoparathyroidism. These are real manifestations but can present, so we have to remember them. So these are basically less occurring manifestations. So this is actually table which showing clinical manifestation of Wilson disease tabular format directly from Nelson. So hepatic disease, the most common organ involved is hepatic liver, 40 to 60%. So OTPT can be increased, acute hepatitis can be seen, acute liver failure can be seen, and liver cirrhosis. Basically, liver issues in form of acute or chronic liver failure leading to decompensated liver failure in chronic or late cases. So this is important. Neurological symptoms are not far behind. These are 40 to 50%. Involuntary movements like tremors, ataxia, and chorea. So, a patient present with involuntary movement in your OPD or clinical practice, just keep DD of Wilson disease in mind. Speech disturbances. So, this is important. This is actually teacher complaint. The patient or child is not able to articulate properly dysarthria, so this is speech disturbance is common. Other the less common like dysphagia, autonomic dysfunction, and gait and balance disturbances. The main symptom is involuntary movement along with speech disorders. Psychiatric manifestation not seen in all, it's seen in 10 to 25% changes like personality changes. Suddenly child become antisocial. Okay, a behavior has been changed. Teachers are complaining child is very distractive. So keep these things in mind. Mood disorder, psychosis, and cognitive impairment. The whole spectrum of psychiatric disorder can occur, but personality changes and mood changes, aggressive behavior is one of the key manifestation of this disease. Again, as we discussed, ophthalmological examination. So, KF ring. So in eyes, in Wilson disease, you can see first is KF ring and second is sunflower cataract. In KF ring, it is very important if neurological symptoms are there to 90% in CNS cases and 50% in hepatic cases, and 20 to 30% in pre-symptomatic cases. So this is actually very important. This is very important. If you find KF ring and CNS disease associated, the chances of finding KF ring is 90% approximately. If patient is presenting with only hepatic disease, chances of finding KF ring is around 50%, and even in asymptomatic or pre-symptomatic patients, 10 to 15% or 20% chances of finding of KF ring. Now I mentioned KF ring is copper deposition in descent membrane, best seen in slit lamp examination. Okay, and what is other abnormality in eyes apart from KF ring? It is sunflower cataract seen in Wilson disease. What are the other manifestations? As we discussed, renal manifestation dysfunction, bone osteoporosis, heart, this cardiomyopathy, skin. This is a hyperpigmentation of lower legs, sky blue moons of nail, xerosis and acanthosis nigrosis. These are non-specific thing, but just you have to remember sky blue moon. And hematopoietic system is discussed, DCT negative, cum negative hemolytic anemia, and delayed puberty, gynecomastia, glucose intolerance, and parathyroid insufficiency are there. So, what are the pathology behind it? Basically, when we do the liver biopsy, what we see? In liver biopsy, there is hepatocellular degeneration. That's why this disease has been called as hepatolenticular degeneration. Unstructural changes in mitochondria, lipid inclusion matrix density, and brain copper accumulation is there. Then comes the important thing. We have seen the child, we have thought of Wilson disease, we did this eye examination. How we will diagnose this as Wilson disease? So, indication of testing like patient present with liver disease, a neurological symptom, hemolysis that is DCT negative, psychiatric symptom, Fanconi syndrome, we have to think of Wilson disease. So, if ceruloplasmin, will see it should be less than 20 milligram per deciliter because it is getting saturated by free copper. So elevated serum free copper is more than 1.6 micromole per liter, and the excess copper is getting excreted in urine, so 100, more than 100 microgram per day. So these three values are very important, we have to remember them. So again, to revise, low serum ceruloplasmin in more than less than 20 milligram per deciliter. Elevated serum free copper is less than 1.6 micromole per liter, and high urine copper excretion is more than 100 microgram per day. KF ring, as we discussed, we have seen in neurological cases 95%, and in hepatic cases it's 50%, and asymptomatic or pre-symptomatic cases 20%. Liver biopsy. So this is important. Uh, Hepatic copper content is more than 250 microgram per gram dry weight. This is important. This is actually important than the above indicators. And genetic testing, obviously, we can do with ATP7B gene mutation. Okay, so this we have diagnosed like biochemical parameters and eye examination. How you will treat Wilson disease? So copper is high. So the simple thing, we have to limit copper intake, but in which quantity? Less than 1 milligram per day. Avoid copper-rich foods. What are the foods which are copper-rich? These are liver, shellfish, nuts, and chocolates. Remember, chocolates are favorite for children, so we have to avoid the chocolates. Also, what are chelating agents? So, copper is metal. We have to use chelating agent which can bind to copper and excrete it in soluble form. So, what are those? First is trimethoprim. So, this is first line therapy and preferred over penicillin. So, which is the first line therapy for chelating agent for Wilson disease. It's tryptine and penicillamine. Yes, this is alternative, but may worsen neurological symptom in some. So, which drug worsen neurological symptom in Wilson disease? That is penicillamine and ammonium tetrathiomolybdenate. So this is actually in under investigation. So Triantine is the major drug we will use in this treatment of this. And zinc. Zinc is used at adjuvant therapy. This actually zinc impairs the copper absorption from the um, GIT. Okay. Liver transplantation, as you know, these are metabolic liver disease. So the definitive treatment or for acute liver failure in these conditions is liver transplantation. So prognosis, if it is untreated, then it can lead to various manifestations, lead to death, and if with treatment, it actually prognosis varies. So liver transplantation curative for end-stage liver disease, but it generally have no or less effect on CNS disease. Asymptomatic siblings, if they are asymptomatic, then early chelation or zinc therapy can prevent disease development. So this was it for Wilson disease. This was detailed discussion in Wilson disease. Just remember the important points. We will meet in another video of this series. Till then, do like, share, and subscribe this amazing series of NEET SS Pediatric directly from Nelson textbook of pediatrics. So till then,